We are joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health.
And Doctor, you've been so great, and we really appreciate you taking the time during this whole pandemic and sharing your expertise with us. Let's begin again with the possible surge of cases and patients that's expected to begin in the next few days. What is the situation with those protective supplies, like the gowns and the masks at South Shore Health?
This is one of our priorities in our system, and you have to realize it's literally minute to minute, day by day. We're constantly looking at our inventory. We're consuming thousands of masks, gloves a day, and we're trying to replace it. But as you know, that supply is very limited. So we have to get as much as we can. I have to tell you that the community has been amazing to us. People are actually making their own gowns and trying to bring it to us. The Kraft family,
nice.
I don't have to tell you how thankful we are to them as well.
So Doctor, what is the solution to all this? I know you got to keep the PPEs coming. Does that come from the federal government? Does that come from the state government? What is the chain here?
It's all about supply chain, Ed. And what does that mean? China makes about 50% of the world's masks and respirators. When this broke out in Wuhan, you can imagine they had to divert the use from around the world to them. Also, everyone was quarantined. The people who are actually making the masks and respirators in China were quarantined, so they were making less. Demand is more. We have less. Our own strategic national stockpile only has estimated to be 1% of the amount we need in the country. That may not be exact, but we need more. We need more supplies. Do
you have any estimate of how many more patients you're expecting to see where you are at South Shore Health after April 10th, the expected start of that surge? Is there any way to determine that?
Yes, we have modelers who are looking at this every day. We're adjusting as to what we see. We know that we're going to see at least hundreds of more patients before over the next few months.
So what can people at home listening to this, what can they do to help hospitals, to help medical staff who are on the front lines of this?
Well, I want to be very clear. The people who are staying at home, socially distancing, listening to that stay-at-home guidance, they are saving lives. The reason is because, as you know, as a system, as a hospital, we can't be overwhelmed with patients. We only have a limited number of beds, limited number of ventilators. So that is so critically important. I can't overemphasize it. Thank you for listening.
It's so interesting that you just said that, Doctor, because I thought maybe you'd say if you have, like you were saying, people were making gowns, or if you have this, or if you have a relative. But the simple advice, and it is simple, is to stay at home. And that's the best way people can help you guys on the front lines do your job.
That's right, Maria.
All right, Dr. Todd Ellerin from South Shore Health. Again, thank you so much. We truly appreciate it. Be well, be safe.